Imagine scheduling hip surgery 2 weeks out for under $1,000, paying $90 a month for full coverage, or spending less than $2,400 for all your healthcare needs, with zero fear of surprise bills. The world's best healthcare for retirees is found far beyond the U.S., for a fraction of the cost. Welcome to EXPAT Retirement Secrets. Today we reveal the 10 countries with the best, most affordable, and most accessible healthcare systems for retirees. 10. Costa Rica universal coverage via the CAJA system, ranked WHO top 30 globally, best in Latin America. The Pensionado Rentista residency means enrolling in CAJA, paying 7-11% of your income, usually $90 or $120 a month for retirees. Private insurance costs $80-$200. The focus, prevention, easy access, and few catastrophic bills. Popular expat areas include Atenas, Grecia, and coastal towns, all with quality facilities. One retiree pays under $2,400 a year for all care, compared to $600 $200 a month in the U.S. 9. Japan's universal system covers all legal residents, with premiums around $200 a month and a 30% copay. Out-of-pocket costs are capped. Life expectancy is over 84 years, and wait times for specialists are typically less than 2 weeks. Routine visits are just $30-$50. Tokyo, Kyoto, and Fukuoka are expat favorites. An American in Osaka had major imaging for $30, all English-speaking, fast, and effective. Japan's outcomes are among the world's best, and total spending is 60% lower than the U.S. 8. Australia universal Medicare for citizens' permanent residents, plus affordable private options. Permanent residents qualify after meeting criteria. Others need private insurance, $140-$250 AUD month. GP visits $30 or $50, mostly refunded. Australia ranks top 5 in the OECD for outcomes, with excellent elderly, heart, and cancer care. Sydney, Melbourne, and Perth offer expat communities and quick access to top-tier hospitals. Many retirees report almost all care is free after qualifying for Medicare, with short waits for tests. 7. Sweden universal, tax-funded care with private insurance for faster extras, about $400 a year, but most don't need it. Residency or a personal number grants access. GP visits are $20.40. Sweden offers world-beating life expectancy, low corruption, digital appointments, and low patient copays. Stockholm, Gothenburg, and Malmö are popular, and the elderly report high satisfaction. Sweden's out-of-pocket costs are about 70% below the U.S., with world-class outcomes. The Netherlands mandatory private basic insurance, $110 to $150 a month. An annual deductible caps out-of-pocket risk, $420 a year. Ranked top 10 by OECD, with rapid hospital access, telemedicine, English-speaking doctors, and high satisfaction. Amsterdam and Utrecht are vibrant, safe, and modern. Expats must show proof of insurance for residents. Specialist visits rarely take more than 2 weeks, and English is virtually universal in the medical field. 5. Switzerland, mandatory private insurance, typically $400 $600 a month, all residents enrolled within 3 months. Out-of-pocket expenses are capped, and there are no surprise bills. Life expectancy is 83 years. Quality and outcomes are world-class. Zurich, Geneva, and Lausanne offer both luxury and efficiency. Clean air and safety come standard. Retirees pay in full knowing they're protected against high costs forever. 4. Germany. Dual universal GKV-PKV system. State insurance is high 14 to 15% of income. Private plans are $100 $400 a month. Eligibility comes with residency and is automatically included. Berlin, Munich, and Hamburg are the top choices for their facilities and infrastructure. Waits are short, digital records are common, and English-speaking services abound. A retiree in Frankfurt pays $120 a month and reports instant hospital access and better than U.S. care, all with transparent, fixed costs. 3. Spain. Universal SNS, public system with private plans $50 $120 a month. Residents qualify automatically or after buying in for $65 a month. GP visits are typically $10 $20 and specialists $60 to $100 with most care covered. Spain's life expectancy is 83 years. Lifestyle is Mediterranean, Wait times are short, and expats rave about the system's efficiency and compassion. Cities: Barcelona, Malaga, Alicante, all with excellent public and private hospitals. 2. France. Universal Puma system and supplemental mutuelle plans, $70 and $250 a month, covers 70% care. Private fills the rest. Legal residents qualify after 3 months. France sits at the top of OECD rankings for healthy lifespan and low infant mortality. GP visits are $25, most reimbursed, and there is a focus on prevention and fast access to care. Hip surgery in Bordeaux, for example, in 2 weeks. Bordeaux and Montpellier are favorites for affordable, high-quality care and easy public transport. 1. Portugal. Portugal delivers universal SNS coverage. Life expectancy is 82 years, and residency, even with the D7 visa, grants almost immediate access. Copays: GP visits $520, insurance $60 to $100 a month. E-prescriptions, modern hospitals, and world-class doctors are the norm. The system is one of Europe's most efficient. The Algarve, Lisbon, and Porto are expat favorites. Most spend less than $100 a month for full care, and specialist access is fast. Safety, mild weather, and a cost of living 40% below U.S. averages complete the equation. Summary: these 10 countries combine the world's best healthcare, with shorter waits, English-speaking staff, up-to-date tech, transparent prices, and none of America's billing disasters. Portugal, France, Spain, Germany, Switzerland, Netherlands, Sweden, Australia, Japan, and Costa Rica offer accessible retirement visas and medical care that rivals or exceeds U.S. standards for as little as $60 or $150 a month. Don't settle for costly, slow, or unpredictable care in retirement. Hit like, subscribe, and comment with your top healthcare country, because world-class medical care is more affordable and accessible than you ever imagined.